can I invite the four of you back to the front? I know that there's going to be questions, and I'm sorry that we haven't got terribly many minutes to go through them. Would anybody like to kick off?
Thank you very much, Karen. I'm going to follow up perhaps on Mike's challenge about what could be cross-disciplinary research priorities or areas of focus that would draw us together. And one theme that comes over again and again is how do we turn these results into practice, sustainable practice, and the diverse ways in which that might be possible, and how different that can be for an intervention that might be a social intervention or a psychological intervention, or a change in housing policy, or a change in how we support people to be educated and learn more about their experiences. I'd like your comments and thoughts about implementation, about making it happen, please.
Okay, who wants that one first then?
Can I go?
Thank you.
Well, implementation in this country is really challenging, and one of the ways in which we can do this is ensure that we produce the building blocks, the evidence that can inform practice and policy. And a really good shortcut in order to do that is to ensure you produce the best quality research that people can have some faith in the results of, and ensure that that gets into the right places. And for my area in particular, ensuring that it ends up in NICE guidelines becomes a really important lever for ensuring that your research translates into practices of policy, because people have to find excuses to not follow NICE guidelines. And if you've got really strong research evidence, that's exactly where it might sit. So, for example, the guidelines in relation to depression are currently being reconsidered by the National Institute for Health and Care Excellence, NICE guidelines. Dave Eakers and I sit on that panel, and we make sure that they know about the research that happens at the University of York and the other stuff that we're involved in around the UK, in order that we can close the loop between stuff that's funded by the National Institute of Health Research that fills an important evidential gap, and that would translate into the evidence-based practice guidance that's issued by the National Institute of Health and Care Excellence. It's not a perfect system, and it's grappling with the areas that aren't immediately informed by randomised controlled trials, for example. So the challenge is that stuff other than RCTs translates into practice. But I can speak on behalf of some of the work that we do. But so that would be my contribution to how we translate this into practice, into policy. Other people on the panel might have some other thoughts. Nicholas?
We do have a problem that pilots are quite easy, and pilots can be quite successful, and we can often demonstrate things are effective. It's systemic change that's the real challenge. Now, I'm pretty much a policy researcher. I'm quite sort of action focused, because a day a week I work with the European Observatory on Homelessness, which is all about practice and converting things. And it is about the quality of evidence. It's also about the presentation of evidence. And it's bearing in mind that if it's going to be a minister or somebody who's a senior civil servant, or it's going to be high up, it's going to be a matter of what you can convey in 3 bullet points, not what even you can convey in a page or two. And you have to think about the politics, not so much the spin, because that starts to get complex and challenging, but you have to think about what the politics are in terms of how you present things. So one of the major interventions around homelessness and mental health is a programme called Housing First. When that got to become federal policy in the States, it was sold to the Bush administration on the basis of cost effectiveness, not on humanitarian concerns, not about homelessness, not about mental health, but on the fact that dollars would be saved. And so you have to think in those terms about who your audience is.
I could just very briefly add 2 points to this. It's also about local leadership, somebody with a passion, with an interest, who can get interventions, new ways of working up and running. But it's also about practitioner research-mindedness, that we can produce a fantastic research, gets into nice guidance, but it's also about practitioners reading the research for themselves and being convinced. And I think we've got a job to do in terms of research literacy.
Thank you. Debbie, did you want to comment?
So obviously the project that I was involved in was an arts and humanities based project, and it was very much more kind of grassroots kind of activism approach. So the Hearing Voices groups that we were working with, they now give this booklet out to their new members when they come along. I know that people who were involved in it gave it to their CPNs and their psychiatrists and friends and families, a way of trying to explore and explain to them how they are coping with the experience. And we've done a bit of training with mental health nurses in Glasgow, and the fact that it's quite a beautiful booklet in itself, and it's a very low-cost project, meant that we had a very limited print run. So we only had 300 copies, so they were very precious to us, and how we distributed them. But the online version, we've had requests from people globally, practitioners, health practitioners, asking for copies.
Fantastic, thank you. One last question? Yeah.
Not really a question, it's just an observation, just in support of the comments you made there, Debbie, is that I think part of how we can change policy and practice is making sure our evidence can be used by service users who can lobby and campaign for change, because often their stories are very powerful and very persuasive.
Thank you.